Omodara Mills. Welcome to Inside Health. In this video series, we explore various departments, units, and services of the Tobago Regional Health Authority, the TRHA. We take you behind the scenes to show you how they contribute to the quality healthcare services provided to you, our people. Now, have you ever wondered what happens to the soiled bed linens at the hospital? Well, today we'll show you the process of how they are cleaned at the laundry facility located at Shore Park. So come on with us and let's go inside to see that process. Miss Juliet Bob, the laundry supervisor at the facility here. Miss Bob, for those who may not be aware, give us an idea of what the laundry services entail.
The laundry services entails that when you collect the linens at the hospital, you bring them down to the laundry. After they offload the truck, then they start to assort as what you have already seen. And after that, then they do the weight, then they load the machines and then start to wash.
Now, while you were showing us around in terms of the sorting when the linens and so initially come in, you indicated that there's a contaminated area that you ensure that there's a separation from the dirty and the clean linens. Tell us about that and the importance of that part of the facility.
Well, the contaminated, why they built it like that? Because the contaminated, not to mingle with the non-contaminated, right? The contaminated, you have so much bacteria and different things, so that could spread at least, even like simply COVID, we have to take precautions, right? So we have the the contaminated area where they're loading the dirty linens, and then we have the non-contaminated area where the clean ones are. Because on mornings before eating, we get them to sanitize them before that day comes out that area.
Could you give us an idea of, in terms of how are the items sanitized? Is it done via the steam or the heat? Also take us through that process of how we sanitize.
Yes, we sanitize by the steam or the heat, because when you wash it for the machines, the heat comes out there, right? And that heat and thing kills all the bacteria, right? And then following up on this now, or even the dryer, we have heat coming out from that. So all that is killing the bacteria from what goes on. We have to ensure that the areas are properly sanitized so that the clothes don't pick up bacteria. So sanitation is one of the most important parts in the laundry, especially the corona that is going on. Staff have their area what to do, so they assort whatever after they come from the dryer, because the ironer was not working at that time. So we have the ironer up and working, so they have to assort and put like the flat sheets, because we don't pass the fitted sheets through the machine, right? So we assort the flat sheets, whatever to go through the ironer, that will go through. So we assort in different areas, and then for the operation of the machine, we do like the sheets, the pillowcases, and so forth, right? So the scrubs, they have different scrubs. They have a silky one and those for press. So we dry the silky ones and press the cotton ones.
And I know besides the linens, you mentioned the linens, the fitted sheets as well as scrubs. What are the other items that are cleaned at the laundry?
We have patient gowns, we have theater gowns, we have scrubs, and leggings and so forth. So all those clean. Plus we have that comes from the hospital or health center, dressing towels and so, right? But we have the TRHA, right? We facilitate them with doing tablecloths, right? So they go through the iron, which we press, right? We have fire service bringing little items through like the slings and so forth that they use. So we facilitate them as governmental.
So you all do not just, you all provide services for a lot of different entities within the government.
Yeah.
I just noticed you all have a sewing room, which is one in-house service that you all provide. Tell us what takes place there and the benefits of having this service right in the laundry facility.
Yeah, well, at least with the sewing room, we have sometimes we have things like the patch or whatever. So we facilitate because we have the slings, we sew scrubs, we sew, we could do patient gowns and so forth. With the seamstress, they have all different things that they can do there, right there. So it's better to have them right here than to have them elsewhere.
Okay, so it's very beneficial in terms of saving costs and that.
Once we get the fabric, we think they cut it out, even like they have fabric for nurses' uniforms and so forth. So they measure how much the nurses and them supposed to get, and then they bag them, tag them, and send them to the hospital.
Well, I just always love sewing, and to me it's really relaxing, and then you see the finished product of your work, and that gives you that enjoyment, that fulfillment, that, when you're seeing something that you have sewn and it's done properly. And it's really beneficial because we have been sewing anything we could say sewable for the hospital. So I think they have been cutting costs.
The present laundry facility was commissioned in 2014. It was equipped with automated laundry machines, which make the work more efficient. Machines are maintained and serviced by the in-house mechanical technicians. You would have looked at the feeder, which is an automated system. I know a lot of the machines that we're using here is heavily computerized, and so tell us about that part of the process and the benefits that it has for the laundry.
Yes, well, they say this is a state-of-the-art laundry, right? So at least when they do it, because it wasn't computerized before, so they now, as they rebuilt it, right, they put computerized, right? So while we were going through the process, we taught who's supposed to operate it, that they learn everything. So at least as it's a state-of-the-art, they put the computerized, so we like above everybody.
So tell me the benefits of this for the laundry facility. Does it make the job easier, faster, and so?
Yes, it does. It does, because at least when we're using the machines also, it's easier and taking less strain off of workers. So we have at least 4 persons on the iron, 2 in the front, 2 in the back. And then we have like 18 to pack, and who pressing, and who operating the dryers and so forth.
In the event that, for example, the feeder needs to do a maintenance check, or it might go down from time to time, could you give us an idea? Are there contingencies in place to ensure that the work still continues?
Yes, we try to facilitate with getting extra parts, because most likely these machines are from BNC, which is in Miami. So it's a distance from us. So we try to facilitate and get enough extra parts.
How do you collaborate with the hospital, with the health centers to ensure that they get the items that they need?
Well, when they are sending the linens, they mark them. They know where it comes from because they have the different linen bags. right? So when we are even sending it out back, we have internal or external slips that we put them on, and then they will know well which area it's going to, especially the wards, the health centers, whoever. Right? We use internal slips for health centers and the wards, right? External is like for TRHA or the fire service.
I have a passion for what I'm doing. I love it. Yes, I really love it. So I enjoy my job here and everything. Yeah, so that's the passion of it, folding. Yeah, that's the folding and learning of this and that sewing. But professionally, I'm all of it because I learned to fold properly. Yeah, I learned how to make full of bedsheet properly. My bedsheet was like, every minute I'm making it up and pulling my bedsheet. So in 3 years, I learned to love the iron more because it's easy and I just love it.
I do all over. I work at all areas at the laundry. I do pressing. And I do folding.
Do you like what you do? Tell us why.
Yes, I know what I'm doing. It is educational and it's important. It teaches a lot of things.
What do you think about the importance of the laundry facility in aiding or helping to improve the healthcare services provided to our patients or the doctors or whoever else would go either to the hospital or to the health centers?
At least with that, I try my little best, or the staff. I am the staff because I cannot do it by myself. So to make sure that everything goes okay, because when we think with any bacteria or anything going up to the hospital, the others man, we are afraid, and then what we don't like for others, what we don't like for ourselves, we cannot give it to others, right? So we have to start with us before we send it out.